everyone, and welcome to the Better Together as One podcast and TV show. My name is Margaret Wallace-Duffy, and I'm always excited to have alongside me for the ride my two amazing co-hosts, Claire Gavin and Mr. Todd Miller. How are you guys?
Excellent.
Great.
You know, we love bringing different types of people to our table to have really insightful conversations. And today we're really excited to have a special guest with us. Actually, we've got a couple of guests today, and we're going to be talking all about medical cannabis. I know many of you are probably wondering, what does that mean? Who can benefit? Well, we've got you covered. And what better person to do that than an accredited medical cannabis educator? Jennifer Silvestri is with us, and we are really excited to learn from her. Welcome, Jennifer.
Thank you. It's nice to be here. Thanks for having us on.
You bet. We are really, excited to have you because let's be honest, over the last couple of years, there's been a lot of discussion in the media about cannabis, and in particular, medical cannabis. We are really interested in diving in a little bit deeper. I want to first say that you come originally from the pharma world. So can you just explain to our listeners and viewers, how do you go from pharmaceuticals to medical cannabis? Tell us your story.
Yes, well, it's kind of an interesting, I guess, the way it's all fallen into place. I was in pharmacy for 30 years, actually, and worked myself up into a corporate position. I went from retail, hospital setting into specialty pharmacy, which was long-term care and retirement. Went to Jamaica one day, came back, and I was given like a golden handshake and says, well, your position is being eliminated. And I said, oh, thank you very much. That was 23 years of service with one company. But it was okay because I had already started to study cannabis. I had that little bit of an idea that I might come into this later on in my life once I retired from pharmacy. So it happened a little bit sooner than I thought, and went on my way and just continued my education. So I went from Durham College. I studied at McMaster University. I'm continuing my studies there in cannabis, as well as the Natural Wellness Academy, which gave me my accreditation. And that one is interesting because it's from the US. It's worldwide platform. It's online accreditation, an amazing course. And I also do mentoring for them, for their students now, which is really kind of a fun thing. That's how I did it. And it just kind of snowballed into one to another. And I interviewed for a part-time virtual position as an educator for Canenta. And here I am.
Well, I know in our discussions, Jennifer, and this is often the case, and we talk about this here a lot on the show, our own personal experience often can lead us down paths. You've had a personal story with medical cannabis. Can you share with us a little bit about that?
Absolutely. So as I started to study and understand how cannabis and CBD oils worked, I did start to take them as well. And not really taking them for any particular reason other than maybe some inflammation for the body. As we get older, the arthritic pain started to set in. So I decided, okay, let me start to take it. And I continued faithfully. Okay, and I say that because it's very, very important that when you do start to use a CBD oil, you need to take it just like a daily vitamin. And I realized slowly, like I was a very, I suffered migraines, horrible migraines. I had a tragic accident when I was 15 years old. I was hit in the head with a bowling ball, a lawn bowling ball. And from that point, concussions were very, very bad. A lot of times hospitalizing me. But going back to the treatment, I realized that after these 2 years have gone by, I can't even remember when I had my last migraine. Okay, and again, it was a faithful taking of the CBD oil. So there's a lot of things that the CBD will help, not just for pain, but what it is done is like because it can open, give you a better blood flow, and these are things that we have to watch for as contraindications for medication, blood thinners and things like that, because it will tend to do that. But it's helped my migraines to the point where I can't remember when the last one is. But not only that, I've always been a psoriasis sufferer. And I went to Colorado to study the apothecary with CBDs and understanding how I could maybe create a psoriasis cream for my skin. Between this cream that I have now formulated successfully and the CBD oils, taking them orally, my skin is amazing. It's unbelievable. And I can't tell you, I used to have injections in my skin so that as a young girl, I would wear shorts because my skin was covered in psoriasis.
Oh.
And I might have little pieces here and there that will pop up. I put a little bit of cream on and it's gone. And I really attribute the CBD oil orally and the creams to have made it all go away.
Unbelievable. And, I think that's so important to share these real life stories. Now, we're going to have you back for a couple more segments, and Dr. Amy's going to be joining us as well. We can't wait to dive into, so who can benefit from cannabis and how do you figure out what you need and all of the details that go with us. So stay tuned. We'll be right back here after the break here at Better Together as One.